Hello friends, continuing the shock series, today's video is going to be on cardiogenic shock. Cardiogenic shock is a medical emergency resulting from inadequate blood flow to the body's organ due to dysfunction of the heart. The causes of cardiogenic shock include myocardial infarction, which is the most common cause of cardiogenic shock. Other causes are arrhythmias, valvular heart diseases, and ventriculoseptal defects. Pathophysiology of cardiogenic shock. The cardiogenic shock can occur because of myocardial infarction or myocardial dysfunction. There could be systolic dysfunction or diastolic dysfunction. In systolic dysfunction, there is problem with the contractility of the heart, because of which the stroke volume is reduced and the cardiac output is reduced. This would lead to decrease in the blood pressure, and the coronary perfusion pressure is decreased, which will cause ischemia and progressive myocardial dysfunction, which may ultimately lead to death. In cases of diastolic dysfunction, there is an increase in the left ventricular end diastolic pressure. Because of increase in the left ventricular end diastolic pressure, the blood can back up into the pulmonary veins, which take the blood through the lungs. And as the pressure in the pulmonary vessels increases, the fluid is pushed into the alveoli, which causes pulmonary edema. Because of this, the normal oxygen movement in the lungs is reduced and it leads to hypoxemia, which will further cause ischemia and progressive myocardial dysfunction and ultimately death. The signs and symptoms of cardiogenic shock. The patient can present with anxiety, restlessness, altered mental state due to decreased blood flow to the brain and subsequent hypoxia. The blood pressure in these patients are low due to a decrease in the cardiac output, and the pulse is rapid, weak and thready. Because of compensatory increase in the heart rate, the patient will experience tachycardia, and because of peripheral vasoconstriction, the skin will be cool, clammy. Due to increased jugular venous pressure in these patients, the jugular veins are distended, and patient will also have low urinary output due to inadequate blood flow to the kidneys. Patient can also present with rapid and deeper respirations due to sympathetic nervous stimulation and acidosis. There can also be pulmonary edema because of fluid backup in the lungs due to inefficient pumping of the heart, and patient can also have frothy sputum. Because of myocardial infarction or angina, patient can also present with chest pain, and patient can also lose his consciousness. The diagnostic workup of cardiogenic shock include serum lactate levels, which are increased in patients with cardiogenic shock. Arterial blood gases and troponins are done to rule out myocardial infarction. Chest X-ray is done. ECG is done, which can help in detecting abnormal heart rhythms or myocardial infarction. A very important test is the echocardiography, which may show poor ventricular function, rupture of the interventricular septum, and obstructed outflow tract or cardiomyopathy. Cardiac biopsy can be done to confirm the diagnosis of cardiomyopathy. In patients with cardiogenic shock, the cardiac index is less than 2.2 liter per minute per square meter of the body surface area. Treatment of the cardiogenic shock. Depending on the cause of cardiogenic shock, every patient's treatment depends on the underlying condition. Mostly the patients require oxygen, so they should be given the oxygen. Medications such as vasopressors like epinephrine and dobutamine are given to enhance the myocardial contractility, and these are the first line drugs to improve the low blood pressure and delivery of blood to the rest of the body. Patients who have cardiogenic shock unresponsive to the medication therapy may be treated with mechanical circulatory support devices such as intra-aortic balloon pumps or left ventricular assist devices. In cases of myocardial infarction, percutaneous coronary intervention may be required, which includes stenting or angioplasty. So to summarize, the cardiogenic shock can occur in various heart-related problems, which include myocardial infarction, arrhythmias, valvular heart diseases, and ventriculoseptal defects. In cardiogenic shock, there is systolic or diastolic dysfunction, which leads to ischemia of the myocardium and progressive myocardial dysfunction, and can ultimately lead to death if not treated at the right time. The signs and symptoms of cardiogenic shock includes a low blood pressure, tachycardia, cool clammy skin, distended jugular veins, oliguria, hyperventilation, fatigue, pulmonary edema, frothy sputum, chest pain, and loss of consciousness. And the treatment is individualized depending on the patient's condition. I hope you understood today's lecture well. I am posting MCQs in my community section of the channel. Please do try to solve them and post your responses in the comment box. This will definitely help you in your exams. Thank you.